Okay, we'll go in 5, 4, 3, 2. Welcome to Cultivated Live for Wednesday, July 30th. I'm Jay Rosenthal. That in the upper left is Jeremy Burke. We have Mitch and Emily from Leafwell. Welcome both.
Thank you so much for having us. It's great to be here.
It is a pleasure to have you. And what we try to do on this show is we like to get, especially when we have founders, we get the startup story. Then we'll get into more and more what Leafwell is doing right now. But Emily, let's start with you. Give us your background. Give us a little bit of background of Leafwell, and then we'll just pepper you both with questions.
Okay, my camera looks like it's gone a little blurry, but I'll continue. There we go.
There we go.
Yeah. Well, so I think I'll just start off and tell you that I come into cannabis as a patient. So I have had breast cancer twice. And so it's been both my experience, my personal experience as a patient who has used cannabis, both during treatment and recovery, as well as what I've seen other patients go through that really inspired me to start Leafwell. And yeah, I think it's good to maybe talk about my why and a little bit about my personal experience. I found cannabis by mistake, really. I was desperate. I was in hospital. I was on very strong opioids, and I tried cannabis because I was still in a lot of pain, and I was stunned when I did, not just because of how effective it worked, but also because of how misunderstood I realized the medicine was, the plant was, and then how little information, how little research there was, and how there was no coordination with the rest of my care. I couldn't talk about my cannabis experience with any of my doctors, certainly not my oncology team. There were no guidelines around dosing and then what product to use or how to use it safely and optimally. Were there any contraindications with the medications that I was on? So I went through that experience, and then I realized that I wasn't alone in this experience, that there were many, many patients who are facing the same experience. And so I started Leafwell really as an answer to some of the challenges that I face and that I saw patients face. And so we launched 5.5 years ago. Our mission was to increase access, education, and research. And we believe that cannabis would become a trusted and accessible part of healthcare in the future, and we really wanted to drive that change. And over the past 5.5 years, we've become the leading platform for cannabis-based care. We've served over 500,000 patients. We operate across 38 states. We work with a network of over 100 healthcare providers. We partner with almost 1,000 dispensaries now, actually, and we've just published our 8th paper. And that's why I asked Dr. Doucette or Mitch to join us today, because he's our senior research director. He's spearheading the research that we're publishing. I think it's so important, especially from this perspective of a patient and the fears that I had in trying cannabis and incorporating cannabis into my health journey. We really need to further our understanding of this plant as medicine. We really need to move the research forward.
I'm going to ask a question that Jeremy usually asks about scale, and this is more sort of business operations. But from 5.5 years, from 0 to 500,000 patients to 1,000 dispensaries to 38 states, that is no small feat to move a business from sort of 0 to that. Like, what have been some of the sort of biggest learnings from like a business operations perspective to get to that level of scale?
So many learnings. So I don't know if you know this about us, but we're fully bootstrapped. So
we can relate.
I'm pretty but I worked in cannabis. I worked in the cannabis industry for 3 years in California. I worked with patients. I worked with medical cannabis clinics, and that was really how I saw, that was my learning of how both the potential of cannabis as a medicine, but also the real gaps that existed. And so I felt like I didn't have a choice but to start Leafwell. And I went out and I took a very small loan And I started it from my bedroom right before the pandemic. And then the pandemic hit and we just experienced explosive growth. And so I have so many lessons. I mean, some of the lessons that are really unique to cannabis are that the US is a patchwork of different regulatory landscapes, different qualifying conditions, and really everyone's experience of the cannabis industry is dependent on where they are, like what products are available to them, whether they can even access it, how open society is to cannabis. Can they talk about it to their doctor? All of these things really is determined by where they are. And so understanding that we were an online platform, and we needed to bridge our online brand to the offline communities to really kind of show up in the way that we wanted for people. So there are a whole host of challenges in doing that. If you can imagine, being a bootstrap company, the US is a big country, and we needed to really sort of meet people where they are. Other challenges are just, you're always under-resourced when you're bootstrapped, at least for the first few years. Thankfully, we're in a much better place now. We have an amazing team, an amazing leadership team, and an overall amazing team. But we're fully distributed. We sit across 20 plus states. I'm actually in London. Most of the team are over in the US. We have a few team members in sort of different countries in Europe, in the Philippines, in Mexico. But overall, the majority of the team in the US are most of the team are in the US. And there are challenges with being a fully distributed team that we've had to be very sort of thoughtful about as we've grown. So hopefully that's not too vague, but I would say it's been many challenges. It's been so fun. Would I do it again? I don't know.
Right. That's the biggest lesson. If you do it again, I don't know. Yeah.
Emily, could you talk a little bit about what it was like trying to, you touched on this a little bit, but access cannabis healthcare in the UK, over 5 years ago, right? Because you spent time in California, which is sort of ahead of the curve. The UK is in a different place. So could you talk a little bit about that and the sort of education that you and your medical team had to go through on that?
So my experience 5 years ago, and it was more than 5 years ago actually. So I tried cannabis for the first time more like 8 years ago, and at that point there wasn't any legal framework in the UK. So cannabis was never part of my sort of reality or really an option for me. I tried cannabis for the first time when I was in California. But even then, it was difficult. So I ended up in hospital in California, and even then, it was difficult to speak to a doctor, to really sort of discuss the concerns that you have as a patient. And so, our pillars, education, access, and research, really sort of represent the three things that I think really needed to be moved forward. And 5.5 years into Leafwell, I feel like we're just at the beginning of our journey, to be honest. I'll give you an example. So I found cannabis as a last resort, and certainly, 8 years ago, that was my experience. People really found cannabis not as a first line treatment or a second or a third. It was because they felt like they had no other option. And the stories were heartbreaking. And then you try it, and if it's effective, and it's not always effective for people. Some people try it for the first time and they have a terrible experience. In fact, the second time I tried it, I had a terrible experience. And if that had been my first time, I probably never would have tried it again. But that in itself, I think, sort of, is an example of one of the real problems that patients are faced with. They have to navigate it alone. There is no clinical oversight. There's no coordination with their care. And those are the things that we are trying to bridge and really sort of, the needs that we're trying to meet today.
Yeah.
Yeah.
Mitch, I want to bring you in. I spent a little bit of time last night kind of trolling about your background on LinkedIn. From what I understand, you have a PhD in health and public policy. Could you talk a little bit about what interested you in the cannabis and medical cannabis space in the first place? I'm like, did you do work on that front during your graduate studies?
Yeah. So great question. Yeah. Thanks so much for the both of you for having us here. My story was really always someone who was very interested in the therapeutic potential of medical cannabis. It was one of those things where, 10 years ago, this was something where maybe you have a conversation with someone, maybe there's a paper or two that's published, but by and large, it wasn't really something that was kind of acknowledged, at least in the academic space. But for me, it was always something that I was personally interested in learning more about. And more than 2 years ago now, Emily approached me, and we had Leafwell, this kind of leading platform that has all of this real world data, and real world data is really important, especially in a place in what we might think of as like an unregulated market compared to like a regulated market by like the FDA, because in those real world data sets, what you can actually achieve from that from a research perspective is really potentially impactful, right? You can start to say a lot about the therapeutic potential about a medical cannabis in general. And for me, that really aligned with my public health approach, which was, for positive treatment options, how can we make sure that there's access and importantly, equitable access, right, across, social economic status. So again, for me, it was a great opportunity to, go from Johns Hopkins in academia to the startup environment where, there's real impact to be made, right? There's people who are, living every day in pain. They have chronic pain. They've been using, prescription opioids for 2 years, and, they don't want to be anymore. But unfortunately, right, there's not necessarily a means for them to kind of come off it that doesn't involve like a lot of adverse events for them. So, for me, I've always been interested in the topic. Definitely published a little bit about it while I was in my doctoral program, but more so has focused on the last 2 years to try to build this evidence base using this real world data set that we have to, build this case of how we actually increase access. And we increase access by making these products, making medical cannabis very similar to what you might think of as other therapeutic options, right? So if you're going to go and try to get access by having it be a reimbursable product, meaning that someone could potentially purchase medical cannabis and have that paid by their health insurance, unfortunately, the only way really to do that is to speak the same language of those people who are making those decisions, like adding it to a drug formulary, for example. And for us, we could increase access, and importantly, equitable access, by trying to take the steps in order to establish medical cannabis as much more of a therapeutic option rather than something that someone just goes to the store and uses, however they wish. So really for us, the research aims have always been to support that business, that idea of how can we improve access for our patients. And so it's been thinking about, how does medical cannabis compare to prescription opioids? Is it more cost effective for patients? Is it more efficacious than other items? And really that's kind of how we've viewed it, and how we in the last 2 years have really published, as Emily mentioned, a number of studies trying to build that use case. So when we have those conversations with people making decisions about how or whether medical cannabis could be reimbursed like a medical product, they feel comfortable, and it's something that they want to support. So really trying to build that use case is really what we've been trying to do. And so far we've been, relatively successful at it, and been able to publish a lot of good stuff that hopefully, again, helps patient access into the future.
Yeah.
What does some of that research say? Sorry, Emily, I cut you off.
No. And I think that, go ahead, Mitch.
Oh, sorry. Yeah. The research says, for specific conditions that we've looked at least, there is, there's pretty solid evidence that, has been published before that we've added to that says for specifically chronic pain, there's a higher probability that someone who uses medical cannabis for a year compared to, say, someone who has never used cannabis in the past year. There's a higher likelihood that that person who's used medical cannabis is going to have a better increase or a better quality of life, right? And we would define that using some validated measures, not just some questions. But also importantly, those individuals would also have lower rates of what we might think of as emergent healthcare needs. So like going to the emergency room, going to going to urgent care. These types of services that are expensive, potentially daunting for patients who are nervous going to the emergency room. I don't know if you have been to the emergency room lately. It's not a fun thing to do, right? So again, and we've shown that not only can the healthcare resource utilization potentially go down, but that it's also cost effective, even when we don't take into account like the reduction of prescription opioids, for example.
And so, just to add a little bit to that, so we've been in this position where we're collecting thousands and thousands of bits of data, as Mitch said, and we've realized that cannabis isn't just providing patients with relief; it's also a healthcare solution that could save U.S. healthcare billions of dollars. And employers specifically carry the brunt of that. Their healthcare costs are rising, I think on average, 7% per annum. They pay an average of over $15,000 per employee per year. And a significant, I think it's around 80 to 90% of employers say their number one objective is to control healthcare costs. And so we showed this research to employers. And this has been, perhaps one of the most exciting developments in sort of our roadmap in sort of what we're doing as an organization. But we've now partnered with a number of organizations who've adopted cannabis care as an employer-sponsored benefit, where their employees can use the Leafwell platform, speak to a specialist, understand how they can incorporate cannabis safely into their lives, and all of that's covered by their insurance. So employers are seeing this as not just fringe, but really as a way to support their objectives. And from an employee perspective, from an access perspective, if your employer endorses this, if they say this is an option for you as an alternative to the medication you're on, it becomes an option for people that it wasn't an option for before. And that's what we're really sort of it really sort of ties into our vision and our mission at Leafwell, is that many, many more people could benefit from cannabis than are actually using it. And if we can get it normalized as medicine, if we can get it into organizations and through employers and eventually through insurance reimbursement, this is available to many more people, and also just what that means for the industry as a whole. It's a very loud siren outside of my window. But what that means for the industry as a whole, right? I think the industry is going through a challenging time now. I think everyone's sort of fighting over the same consumers, and so by really sort of building this business case that we're committed to, we believe that not only can we help millions more people, but we can also help the industry by in doing so.
Mm-hmm. Yeah, we've seen that on the Canadian landscape. There's a number of sort of big unions that have partnerships with licensed producers to offer reimbursed benefits to their retirees, especially in sort of construction trades. It's very compelling. So let me ask a question, sort of the good work that's been done now to get to incredible scale. We talked about some of the research, and then within the past week, I think you guys announced the Cannabis Care program. Do I have that right? I while
That's
he
right.
was trolling Mitch, I was trolling you, Emily, and you posted something on LinkedIn. Give us a little view of that.
Yeah, I mean, it's really what I've just started talking about, but it is. So we started 5.5 years ago with connecting people to a provider so they could get certified for cannabis and purchase cannabis. They needed a medical card to access cannabis, but of course, as the years have gone by, many of the states have gone from medical to AU, and people don't necessarily need a medical card. Well, they don't need a medical card in many instances to access cannabis in states like New York and Massachusetts. But they are still looking for therapeutic guidance. They're looking for, they do want to speak to a doctor or a healthcare provider. I think even more so now because it's becoming increasingly mainstream. And those, those people are the people who are entering the industry now are a little bit hesitant. They aren't the early adopters. They have, maybe there's lingering stigma. They have reservations, but they do want to speak to a healthcare provider. So we launched, and it's something we've been building for a few years actually, and we just announced it. But we launched Cannabis Care, which is is where people can go and speak to a healthcare specialist. So they can go on and speak to an oncology specialist, for example, or a surgeon, or an OBGYN, and discuss their specific medical treatment and any questions they have around safely incorporating cannabis into their treatment plan. They can receive a personalized care plan. They can receive dosing guidelines. It's really treating cannabis as medicine, and there's that continuity of care as well. So, in a patient's journey, they may need to speak to various different healthcare providers, and our platform enables them to do so. And then through our network of dispensaries, which is almost 1,000 now, we offer a unique member discount. And this is really a proxy because reimbursement doesn't yet cover the medicine. And so what we've done is been able to negotiate this. It's up to 30% of any product if you're a member of Leafwell.
It's a compelling. It sounds like a good program, and at scale, it's super compelling to an industry, as you said, that is looking for ways to engage more patients and sort of be in contact with them over time. It's very compelling. Jared, what else?
Yeah. One more question. I know we're coming up on time here, so I don't want to open a whole new can of worms here. But one more question that I'm sure Emily and Mitch, you both think about a lot. I think about it a lot as a journalist. How do you work to combat some of these narratives about medical cannabis and cannabis legalization more broadly that, in my view, are pretty fact-free? There's a strain of American politics that thinks legalization is going to create social disorder in cities and all of the above. And, some of the work we do, like we cover the industry and we push back on that. But I'm just curious, like, how do you guys think about that? And what can the work you do and the research you do show to illuminate that is not the truth?
I missed a little bit of that, so I think I got it. But what specifically are we combating?
The sort of misinformation or the narrative that cannabis legalization can create, social disorder or whatever the sort of, Reaganite talking point that surfaced again. Yeah.
Perfect.
I'll go first, but feel free, Mitch. I think we need to follow the science. We need to follow the science. We need to better understand cannabis as a medicine. We are relatively early in our understanding of cannabis and its utility as a medicine. And I think if we follow the science, if we move that forward, if we understand cannabis not as this sort of this magic pill, but really understand it objectively. What are the adverse events? What's the safety profile? What are the contraindications? I think that's number one. I think number two is physicians and healthcare providers need to be need to get behind this, and obviously we've come a long way. Even in the time that I've worked in cannabis, I remember sort of reaching out to doctors when I first started, and just everyone hanging up on me. And then we'd have all the doctors who worked with us were already retired, so they had, they felt like they didn't have anything to lose. They weren't risking their medical license, and now we're getting people who are just starting their career, and they're like, this is what I want to dedicate my life to. So we've seen a whole evolution, even in terms of provider adoption. But I do think that that's important, because if we're going to reach the cannabis naive or the cannabis curious, not the early adopters, not the people who are already consumers, they want to, and I think of my mom or my aunt, definitely use cannabis. They want to speak to a healthcare provider. And so I think that's the second thing. And the third thing that I would say that we're doing is really focusing on the patient experience. And the truth is, the current medical cannabis landscape is not, I don't believe the future of what medical cannabis will look like is the current medical cannabis landscape. That's just not the patient experience. Patients will get a medical card if that's what they need to do to access cannabis. But what we've seen and what we hear, we somewhere between 15 to 20% of the dispensaries we partner with are AU dispensaries, adult use dispensaries. And they partner with us because they say that a significant number of people that walk through their doors are looking for a therapeutic outcome. They're not patients, they don't have a medical card, but they're looking for a therapeutic outcome. And so I think that we need to recognize that, and that's why we're really modeling this against the sort of the sort of wider framework of healthcare. And I think if we do those three things, that will sort of answer any sort of respond to the narratives appropriately and really change people's minds and normalize this.
Yeah, I want to. So thank you, Emily and Mitch, for your time today, and Jeremy for your time today. From all across the globe, we're convening to talk about this. So I appreciate the time. Appreciate hearing about Leafwell. We'll have you on again to talk about, well, anything you want. It's been a pleasure. So we could talk about any new upcoming research that's coming out, any products launching, that sort of thing. But thank you for your time today. We'll connect with you soon, and thanks everybody for tuning in today.
Thanks everyone. It's great to see you.